Hey everyone, and welcome back to StudynurseIQ. I'm Jeannie, and today we're diving into a topic you'll absolutely need to know for nursing school, clinicals, and the NCLEX, tuberculosis, or TB. We'll cover what it is, how it spreads, and most importantly, the nursing care you need to provide. Stick around until the end because I'll have a quiz to test your knowledge. Tuberculosis is an infectious bacterial disease of the lungs caused by Mycobacterium tuberculosis. This bacteria is a true master of disguise. It's transmitted through the air when an infected person coughs, sneezes, speaks, or even sings. This makes it incredibly contagious. In fact, the bacteria can remain suspended in the air for several hours. Once inhaled, the bacteria attach to the tiny air sacs in our lungs called alveoli. This triggers a massive immune response. Our body's immune cells, called macrophages, swarm the area to try and contain the bacteria. This battle leads to inflammation and the formation of granulomas, which are clusters of immune cells that wall off the infection. The presence of these granulomas is a key sign of a TB infection. Signs and symptoms. A person with active TB will show specific symptoms you need to look out for. These include a persistent cough that lasts for 3 weeks or longer, coughing up bloody or purulent sputum, night sweats, unexplained weight loss, fever and chills. These are the exact symptoms we screen for when a patient is admitted to the hospital. If a patient presents with these signs, they must be immediately placed on airborne precautions until TB can be ruled out. Diagnosing TB involves a combination of methods. The most common is the Mantoux skin test, also known as the PPD test. A small amount of tuberculin protein is injected intradermally, just under the skin, in the forearm. The patient must return to have the site assessed within 48 to 72 hours. This timing is crucial. If they come back later, the test is invalid. The nurse will then check for induration, which is a firm, raised area. The size of this induration is measured in millimeters, and the result is interpreted based on the patient's risk factors. The interpretation of the Mantoux test varies. For a healthy person with no risk factors, an induration of 15 millimeters or more is considered a positive result. For individuals with elevated risk based on living or work environment, 10 millimeters or more is positive. For high-risk or immunocompromised individuals, just 5 millimeters or more is a positive result. It's important to remember that a positive skin test does not mean a person has active TB. It only means they have been exposed to the bacteria and have a latent or active infection. For people who have received the BCG vaccine, a common TB vaccine given outside the US, the Mantoux test can give a false positive. In these cases, a blood test like the QuantiFERON Gold Plus or T-Spot TB is recommended, as these tests are not affected by the vaccine. If a skin or blood test is positive, the next step is a chest X-ray and a sputum culture to determine if the patient has an active infection. For the sputum culture, 3 samples are typically collected on 3 different days, ideally first thing in the morning. Treatment and nursing care. Treating TB is a long-term commitment. Patients are usually on a combination of up to 4 antibiotics for 6 to 9 months. Some of the key medications are rifampin, isoniazid, pyrazinamide, and ethambutol. Our ripe orange mnemonic can help you remember them. R for rifampin, I for isoniazid, P for pyrazinamide, E for ethambutol, and orange reminds you that rifampin can cause an orange discoloration of body fluids, which is a normal side effect. When a patient is hospitalized with active TB, you must follow strict nursing care protocols. Place the patient in a negative pressure room. Implement airborne precautions. You must wear an N95 mask or a powered air purifying respirator before entering the room. If the patient must leave the room, they must wear a surgical mask. Educate the patient's family and close contacts that they will need to be screened for TB. A patient is considered no longer infectious once they have 3 negative sputum cultures, taken on 3 separate days. NCLEX-style questions. Let's test your knowledge. Question 1. A nurse is caring for a patient with a confirmed active TB infection. Which nursing intervention is the highest priority? A. Administering antipyretic medication for fever. B. Placing the patient on contact precautions. C. Ensuring the patient wears a surgical mask for transport. D. Educating the patient on the importance of completing therapy. Correct answer, C. Ensuring the patient wears a surgical mask for transport. Rationale. While all of these are important, preventing the spread of the airborne infection is the highest priority. Patients with active TB must wear a surgical mask when leaving their negative pressure room to prevent the transmission of bacteria to others. Airborne precautions are the correct type of isolation, but wearing a mask during transport is a specific application of those precautions. Question 2. A nurse is assessing a patient with a positive Mantoux skin test. The nurse knows that the interpretation of the test result depends on the patient's risk factors. An induration of 10 millimeters or more is considered a positive result for which patient? A. An 85-year-old with no known risk factors. B. A homeless patient who lives in a shelter. C. A 30-year-old with a recent negative HIV test. D. A nurse working in a pediatric clinic. Correct answer B. A homeless patient who lives in a shelter. Rationale. A 10 millimeter induration is considered positive for individuals with an elevated risk of exposure, such as those who live in crowded environments like homeless shelters. An induration of 15 millimeters is positive for healthy individuals with no risk factors, like the 85-year-old. A 5 millimeter induration is positive for immunocompromised patients, such as those with HIV. A nurse would fall into the category of elevated risk 10 millimeters or more. Question 3. A patient with active tuberculosis asks the nurse how long they will be contagious. The nurse's best response is A. You will no longer be contagious after 24 hours of starting your medication. B. You are not contagious once your fever and night sweats are gone. C. You will no longer be infectious after you have 3 consecutive negative sputum cultures. D. You are infectious until your cough has completely resolved. Correct answer, C. You will no longer be infectious after you have 3 consecutive negative sputum cultures. Rationale. A patient with active TB is considered non-infectious once they have completed a significant period of antibiotic therapy and have produced 3 consecutive negative sputum cultures, typically collected a week apart. This is the definitive metric for discontinuing airborne precautions. All right, that's a wrap on our review of tuberculosis. I hope this was helpful. If you found this video valuable, please hit the like button and subscribe to our YouTube channel, StudynurseIQ, for more simple and clear nursing content. Thanks for watching.